Hey guys, it's Dr. Josh. Today is day number 7, aka week 2. Okay, so this means it is the start of your aggressive rehab program. And now what we're going to be doing is we're going to be entering in phase number 1 of rehab program. Now, you're going to be doing this exercise depending on what you can do right now. Some people say 2 times a week, some people will say 3. I would say 4 times a week would be a good opportunity to really start to strengthen this very quickly. The more you do it, the better off you'll be. Yes, you may be sore, but one of the first exercises you're going to be doing daily is a 10 to 15 minute bike ride. Very simple, don't need to explain it. You're just going to hop on a bicycle or a cycle, stationary cycle, and we're going to ride 10 to 15 minutes every single day. You don't want to go too fast, and we don't want to go too slow. Too fast means we have too low of a gear, and we're kind of like maybe adding a lot of pressure and whipping to the knee, which is what we don't want. Too hard, there's too much force going to be driven down at the knee, and it might be too much of this type of thing, too much of a muscular contraction. So we want just small, rhythmic stabilization. We want to really be able to get that endurance up, that strength up, some blood flow into the knee, and that is going to be one of your exercises. Another part of the exercise we talked about in the past is going to be the inversions. And inversions, we showed this in the past where we bring the knee up, we come up, we point the toe this direction, and we're going to come up. So we're trying to put the toe to this shoulder, and we're going to push down opposite. Then what we can do is put the toe down to the bottom, and we're going to pull to this opposite. So we're really resisting. In this case, you may feel a little bit of tenderness in any of these areas, but remember, we're only going to hold this for about 5 seconds. From here, we're going to bring the opposite toe, or the small toe, up this direction. We're going to bring it this way, and then we're going to bring it this way, and we're going to come up and do this direction. Okay, so we're going to do all 4 directions. I highly recommend that you guys do both this side and this side. Make sure you get both of them. So that is how I would like to start my rehab program. The next thing I'll do is isometric glute bridges, which is what I've shown you in the past as well. We'll get onto our back and we'll just lift our hips up. And I want you to imagine not just lifting your hips up, but driving your foot and splaying it out down into the ground. This is much better done with regard to barefoot, but you're going to come here and you're going to hold this for 30 seconds. That's going to be your next exercise. After you do the second that exercise, if you're able to do this, you'll do isometric walking lunges. So that means you're not going to do a lot of movement. You're going to just come here, walk, and you're going to step. If you hear my steps, if you listen closely, you don't really hear stepping. That means I'm slow, I'm controlled, my body's moving, it's working properly, and I'm not doing this. Okay? We don't want to hear slapping of the feet. We really just want to be very slow, very controlled. And once you're able to do that, you're going to do at least 20 total, maybe 30, depending on what you're capable of doing. Now, I've showed this other exercise in the past. It's called the Lemmy Scat. And what we're going to do is we're going to take this knee. So we're going to talk about this knee working, right? So what we're going to do here is we're going to bend this knee. You could do this off a bench as well. We're going to anchor our pelvis and our lower back here down into the ground. So we get a lot of our strength from doing this. Ready? Not from here, but from doing this. So now we're anchored deep. Our butt is driving down to the ground. We're going to straighten the leg, and we're going to heel kick. I'm almost going to kick the heel towards you. Now that I kick that, I'm going to pretend like I'm internally rotating. As you can see, this kind of dive this direction, right? We're going to dive this direction, and then the femur is going to rotate this direction. There it is. So you can feel almost like a twisting motion. And we're going to hold this, and we're going to squeeze our quad. Hold, hold, hold. It's going to be really hard. I want you to drive your butt down, drive your spine up, drive this out, and really trying to create a maximal tension through here. The thing is, here right now, we're going to hold this position, and we're going to hold that position for about a certain percentage. Now, you want to get up to about 90% contraction rate for about a minute or something like that. But right now, we're going to hold back. We're going to dial back at 50%, and we're going to do about 20 seconds, give or take. Okay, so we're going to come in, and that is that. So we have had, so far to start, we have a cycling, so about 15 minutes there. We have our internal inversion, eversion. We have our glute walks. We have, in addition to our glute walks, we have the isometric glutes. We also have this. And then we also are going to have our lateral lunges, which I'll show you in the next video. And then we're going to have the wall squats. That being said, guys, this is a full rehab program. And because this is a full rehab program, you're going to be doing this every single day that you can. If you want less than desired results, then just don't do it as much. If you want more than desired results, then do it more often. If you're an athlete or somebody who's looking to strive to get back to activity as fast as possible, I would highly recommend that you do it 3, 4, 5 days a week, but definitely no less than 3. Your goal is to try to get this done in 20 to 25 minutes. And if you need to take a break between exercises, that's okay. If you're sore the next day, that is okay. Now, you're not going to change the exercises. One big mistake that a lot of people make is like adding exercise, or I think I should do this. No, stick with these exercises. These are the given step-by-step proven program. It is definitely going to help you. It's the thing I'm actually doing to help my knee. It's helping extraordinarily amount right now, and I'm getting results very quickly, and this is what you should be doing daily, okay? So do this for at least 1 week, if not 2. Maybe you can add a little bit more sets and reps on the next week, but right now, this week, you do not change a single thing every single day, okay? So happy recovering, guys. This is phase 1. Let's get it started. Welcome to the program, and I hope you heal well. So one of the exercises that you're going to be doing is going to be a lateral walk. And what we're going to do is slowly start introducing our knee to side movements, right? We're trying to operate it and keep it in a very healthy linear sense and strengthen in that position. But right now we're going to slowly introduce it going side to side. So to do that, what I'm going to do is I'm going to step back so you can see a little bit more. We're going to get into this very athletic position, and we're going to go side to side this direction, being very mindful of our foot, our ankle, our knee, and our hip position. And we're not going to have it torque out this way or this way. We're not going to be exploding off of this side. We're just going to go side and to side. We're going to do about 20 on each side, and we're slowly going to introduce our knee to going side to side so that we can really start building that lateral stability that you may have lost when you first injured this knee. So another very easy exercise that you're going to be doing that's going to really help strengthen the knee and the hip and the alignment is going to also be the wall squat or wall sit, okay? So what we're going to do is we're going to place our back up against the wall, and we're going to sit our knees. Now, it may be hard for you to see it in this position, but if you've noticed, I'm not all the way down like this way, because right now, if you're still in the phase 1 program, which is what you're watching here, is that we don't want our knee at that position, because I can tell you that when I'm at that position, I can feel pain and pressure. So what we're going to do is we're going to sink down as low as you can without any pain, and we're going to hold it in that position, right? So if it's this high and this is all you can do, that's okay. It's also really great if you do this barefoot, really starting to anchor your feet and your toes into the ground, not using shoes, but we'll come in and we'll hold this position. And to get out of this, one of the best things to do to get out of this is to push off the wall or push here. I don't want you to come all the way up and slide up, especially if you have some knee pain. So I want you to use some assist to come up, push yourself off the wall, and that is how you do a wall squat or a wall sit. And we're going to hold that position for a duration of time, really starting to get the quads active and the feet active.